How Medicare penalizes hospitals for being too careful. Chicago, the puffiness along Carol Asher's left leg seemed like normal swelling, probably from the high dose of chemotherapy Dr. Carl Billamoria had injected the previous day. But it could have been a blood clot. He quickly ordered an ultrasound. "We were just being abundantly cautious," he said. Such vigilance is a point of pride at Northwestern Memorial Hospital. But the hospital's tests have identified so many infections and serious blood clots that the federal government is cutting the institution's Medicare payments for a year, by about $1.6 million. Nearly half of the nation's academic medical centers are being punished similarly through one of the federal government's St. Ernest attempts to promote patient safety. Medicare is reducing a year's worth of payments to 758 hospitals, including some of the most prestigious teaching hospitals in the country, with the highest rates of infections and other potentially avoidable complications, including blood clots after surgery, bed sores, hip fractures and sepsis. The penalties, created by the Federal Affordable Care Act, have incited a vehement debate about quality at many academic medical centers often revered for cutting-edge treatments and top specialists. Are these vaunted hospitals really more dangerous than local, unsung hospitals? Or, as Northwestern and some other academic medical centers argue, are these hospitals being perversely penalized because they are so aggressive in screening patients for problems? At Northwestern, the penchant for ordering lab tests is so prevalent that physicians often refer to a culture of culturing that they credit for helping to keep the death rate there lower than at most hospitals. "If you don't look for infections, you're never going to find them," said Dr. Gary Noskin, Northwestern's chief medical officer.